Hare Krishna. I am Mukta Sunil Kuyare, representing Bhaktivedanta Hospital and Research Institute, and I warmly welcome all of you to today's Health Talk Neurological Disorders, the Ayurveda Perspective, streaming live on Hare Krishna YouTube channel. At the outset, I would like to introduce you Bhaktivedanta Hospital and Research Institute. It is a 300-bedded multi-speciality tertiary care NABH accredited hospital located in Mira Road, Mumbai. We offer holistic healthcare services based on body, mind and soul by integrating the strengths of allopathy, homeopathy, Ayurveda and other complementary therapies under one roof. We have always believed in and delivered an integrative approach to treatment and healing, ensuring the overall well being of every individual. Today's program is being conducted under our initiative ISKCON Desire Healthcare Services. This initiative was launched in Mayapur in 2024. Since then, we have served more than 10,000 devotees over the globe, and the number continues to grow. It is our privilege and honor to speak about Vaidyaratnam Govardhan Ayurveda Hospital, located amidst the serene and lush natural surroundings of Govardhan Eco Village, located at Palghar district, Wada. This hospital offers authentic Kerala Ayurvedic treatments, Panchakarma treatments, and comprehensive management of chronic and lifestyle diseases under the expert supervision of experienced Ayurveda consultants. In addition, they provide yoga, meditation, and sound healing sessions, and several other holistic wellness therapies. We are also proud to share that Vaidyaratnam Govardhan Ayurveda Hospital has been honored the prestigious FICCI Best Wellness Healthcare Award in the year 2026. And now it's my pleasure to introduce you to our today's speaker, Dr. Anil Kaimal, consultant in Ayurveda and Chief Medical Officer at Vaidyaratnam Govardhan Ayurveda Hospital. Dr. Kaimal has an extensive experience in the field of Ayurveda and is dedicated to promoting authentic Ayurvedic healing through an evidence based and holistic approach. His expertise in Panchakarma and the management of chronic and neurological disorders has benefited numerous of patients over the years. In today's session, we will be discussing these neurological disorders with a special focus on Parkinson's disease, multiple sclerosis, and peripheral neuropathy. We will explore their holistic management and preventive approaches through an Ayurvedic principles and practices. With that, let's begin today's enlightening talk show. Welcome to the show, sir.
Hare Krishna.
Hare Krishna. So, doctor, neurological disorders are becoming increasingly common today. So, what do you feel is the contributing factor for this rise, sir?
Okay, this present era is everybody is in busy life. They are
Okay.
not at all having any time to seek their health. That is the main thing.
Correct.
So they are not at all following a proper regimen, no food habits, no proper food habits. Food are taking, but it is not a proper food habits, junk foods, everything. And
Right.
there is no proper time for sleep, more screen time. And with that, more stress is developing, physical, mental stress, and all it is developing. With that, there are so many changes which is happen in our body. We are not at all focusing the health of ourselves. That is why it is nowadays most commonly diseases are it is continuously increasing in number. In that, one of the major area it is the neurological disease condition,
Okay.
because by means of properly, if we are not following our regimens like food habits as well as our activities, the sedentary lifestyle and all, automatically that will increase the body's according to Vada, according to Ayurveda, when we are seeing the Vada with Vada Vigobam, that is
Okay.
Vada Kobam will be happen. So Vada will be
Vada Vigobam.
aggravating.
Okay.
Yeah, Vada will be
Correct.
aggravating the factor slowly. That will be debilitating our energy level in the neurological conditions as well as other motor functions also. That
Okay.
is the way Ayurveda is that displaying of these Vada disorders. In that Vada disorders, these neurological diseases are more commonly happening.
Interesting, sir. Okay, that takes me to another question. How does Ayurveda understand these disorders affecting the brain and the nervous system compared to the modern medicine, sir?
That I already explained that our lifestyle itself, it is creating so many dryness, which creating a dryness in our body. That
Correct.
dryness is also our that sleep pattern. Normally we are normal life persons are going to sleep by 12 o'clock
Correct.
or more than that.
Right, sir.
So according to Ayurveda, it is telling that ratri jagaranam ruksham, like that. Ratri, if we are not properly going to our bed,
Mm-hmm.
minimum one yama, after one yama, if you are going, automatically your body is it is on
Oh,
shutdown time. So after sunset, you want to be go minimum within a 3 hour, you want to go to sleep.
correct, sir.
Within that time, our body is slowly it is shutting down. So
Oh,
we are continuously using our laptop, computer, everything, but we are not shutting down
understand.
our system in a
Correct,
proper
sir.
time. If it is
Understand.
proper timely shutting down, then automatically that will open up in the morning before sunrise
Okay,
itself.
correct.
So that will be more active. That brain, it will be more active before sunset, sunrise. Same one yama before you want to, that is 3 hour before sunrise, you want to wake up. Yeah, then
Okay,
your brain, it will be more active, so
okay,
you can do more that productivity, it will be there in that time.
correct,
But we wants to finish off all the work in the night itself. That is the main thing.
correct,
So how
correct.
much time we are wasting that for to that finish our that work in the
Mm-hmm.
night time? A half time only needed to finish in the morning time.
Oh, that's
That
great,
is, if you
sir.
are using a 3 hour time to finish your work in the night,
Mm-hmm.
if you are getting up by 3:30, 4 o'clock, you can finish in within 1 hour. So that
Okay,
type of sharpness, it will be there in our brain. So that brain, it is not properly function in the night time, and
correct,
we are giving more what is called as more pressure on the brain. So once
correct.
the continuously giving the pressure, automatically brain also, it will be slowly cut down by its own working conditions.
Right. So we
So
should,
that is why these neurological disorders are
correct.
slowly starting from the brain and brain nerve system based
So
conditions.
that says that we should not be a night owl.
Yeah, sure.
Okay. So moving on, sir, which dosha plays the most significant role in neurological disorders and why?
Mostly, according to that condition of this dryness increasing in our body,
Mm-hmm.
Vada is the first place.
Mm-hmm.
Vada is coming the first place. We are, according to every body's constitution, to know logically that Ayurveda is to know the body's constitution, it is placed Vada, Pitta, and Kapha.
Correct.
In that, Vada is placed mainly that it is a constitution, that is bio constitution level only, that
Correct.
we are that segregating these three things.
Correct.
So Vada, we are looking in that Vada means it is all motor functions,
Mm-hmm.
all functions. It is from that voluntary and involuntary movements which is happen in our body. It is the part of Vada. And
Okay.
when we are coming to the Pitta, it is the all transformatory conditions. Wherever that hormones are coming, wherever the digestive enzymes are coming, any acid related things which is happening in our body, transformations are happening in our body, it is connected to that. And when we are seeing the Kabha,
Mm-hmm.
that Kabha is more connectivity in the body.
Correct.
So wherever the connectivity is there, that is called as Kabha. It is not the
Mm-hmm.
Kabha, it is like we are sputum, what we are spitting out.
Correct.
Kabha means it is all connection, that is joint connections, our
Mm-hmm.
muscle connections,
Mm-hmm.
our nerve connections, everything it is connected to connect with the effect of the Kabha. So
Right.
in that, all these Saumya gunas, that is all this connectivity and all, it will be slowly, it is taper down when the Vada is increasing.
Okay.
When the dryness is increasing in our body. So
Right.
dryness, automatically that all Saumya gunas, these
Everything
oil
goes off.
things,
Correct.
all these Saumya gunas, and
Right.
slowly vapor down.
Right.
So with that, what is happened? So Vada, it will be aggravate. When the Vada is aggravate, that all degenerative condition, it will be started.
So,
So in this neurological condition, Vada is the main predominant dosha
right.
which we are seeing. Then also, while treatment, we want to consider this all the three.
Right. So
Because
this,
of what this Vada is aggravated, that we
correct.
want to see, and the root cause we want to treat. That is
Okay.
the way Ayurveda is going.
So I just wanted to take one question from the audience, which has come up since we are talking about the s- rising early, sleep, not sleeping very late. So there's one question: how about the nighttime shifters, sir?
Nighttime shifters, it is very difficult to
So what do you
to give
recommend for those
because
people?
according to Ayurveda, it is telling that if we need that much need is there for the night time, we want to work, then you should take a break. That is, you want to take a sleep
Correct.
in the daytime. That is also before lunch time.
Mm-hmm.
How much time you worked in the night, a half time, that is a
Correct.
3 hour if you are work, or 6 hour you are work, then you want to sleep for a 3 hour. If
Okay.
you work for 8 hours, you want to sleep for a 4 hour, not more than
Okay.
that. It is
Right. Right.
morning night shift person are coming in the morning, and they are immediately take some food, and they are going to sleep by 6 o'clock, and then they are sleeping till up to evening 6 o'clock. It is not a good thing.
Correct, sir.
So if they work for 8 hours, then they want to sleep for 4 hours only.
Okay.
So after taking
Agreed.
some breakfast, then by 7 o'clock they can have a sleep for a 4 hours.
Understood.
Then they can wake up by 12 o'clock, and they
Correct.
can take their lunch and all other things, and all it will be happen. If it is that cycle, it is continuously happen,
Correct.
automatically their health, it will be maintained properly.
Okay. And there is one quick tip if we can do to maintain a healthy and sound brain. That's again the continuation of your question, sir.
Ah.
Just one tip if you can give.
That is to just do a proper meditations. That
Correct.
is a yoga nidra. If they can practice yoga nidra, it is a very good. That is that sound healing technique, some music therapies.
Correct.
That will be make a proper brain calming things. It will be there.
Okay.
Brain calming is the only thing we can provide for a that brain function enhancement.
Correct, correct. So what we do now is we will take into respective disease specialities. So, sir, we move on to Parkinson disease. So, sir, what is it, and what are the early warning signs of Parkinson's disease?
Parkinson disease generally nowadays it is a very prevalent in most of the aged persons are in previous years and all, it is aged persons only it was affected. Nowadays it is not like that. Even a 40 years of age persons also it is getting, even females also getting this Parkinson's disease, not males. Previously it is not like that. For males are more prevalent for to getting this disease, but now females are also getting this Parkinson disease. So it is a first symptom of Parkinson disease. Generally, people are notice it is a shivering,
Correct.
that hand
So
shivering and
that
all.
is
It is,
explained in Ayurveda.
yeah,
Parkinson's
it is
disease. Okay.
Parkinson disease itself. It is not explained in Ayurveda.
Mhm.
Ayurveda explained is somewhat similar to this Parkinson disease. That disease name it is called as Kambavada. Kambanam.
Okay.
Kambanam
Okay.
means a shaking.
Correct,
Shaking
sir.
hands. Shaking hands is one of the major symptom. But according to Ayurveda, every condition of the Parkinson disease itself, it's that performance is in different conditions in different patients. So
Agreed.
some patients are with the shivering, with the hand shivering, that finger shivering and all, it will be there. In some persons are it is not at all having this shivering and all. They are having showing some rigidity on their movement,
Correct.
slow movements, and sometimes their balance it will be changed.
Mhm.
So this type of variations in their uh, disease manifestation or the symptoms we can see in according to the conditions of the body.
And can Ayurveda, sir, help slow the progression of Parkinson disease? What do you feel, sir?
Definitely, because Ayurveda is looking to this Parkinson disease. It is a neurodegenerative and progressive disorder,
Correct.
and it is a progressive disorder. How much progression we can restrict, or
Mm-hmm.
we can just pause, or we can just reduce the pace of that disease progression. That is a good thing for the patient,
Okay.
because that is a quality of life improvement also, that will be get it. Otherwise, what is happen normally, this type of diseases are happening to the persons who are very very much enthusiastic and
Correct.
working workaholic, that type of persons. If they are having this much as limitations, they are frustrations, they are going to depression, slowly that will be goes to the dementia, that type of
Correct.
disease conditions.
Okay.
So how much we can slow down the progression, that is more beneficial for the patient. So according to Ayurvedic science of treatments, definitely we can reduce the
We can
intensity
correct.
of the conditions, as
Can
well as to
reduce.
just pause, slow the progression of the
Correct.
disease.
Correct, sir. So this brings me to ask you one question: what Ayurveda therapies have shown promising results in Parkinson's disease patients, sir?
Definitely, I am having a lot of Parkinson cases are there with the Ayurvedic management. What is my way of approach, it is that we should not be totally stop one system. There will be continue some of the allopathic medicines and all, it will be there.
Correct. Correct.
That is mainly to slow down or the controlling of their symptoms,
Correct.
their shivering, their that
Perfect.
stiffness,
Perfect.
and that condition and all, that they will be take that medicine. That medicine we should not be stopped,
Okay.
that
Correct.
we continue with that medicine. Some of the treatments, as well as some of the supportive medicines are there to improve the brain function, neurological function enhancement, that
Mm-hmm.
type of things are there.
Mm-hmm.
So that a proper integration is happen,
Correct.
definitely that patient it will be get benefited.
Okay, sir, which herbs are commonly used in Ayurvedic treatment for Parkinson's disease,
Ah,
and how do they work?
in Ayurveda, there are a lot of studies are conducted in Parkinson's disease management. In that, one of the drug it is called as that this Kabi Kachu. It is called
Kabikachu.
its
Okay.
botanical name is Mucuna
Mucuna.
pruriens.
Okay, sir.
It is a herb itself. It is it's that seed it is using.
Mm-hmm.
Seed that seed contains that L-dopa. It
Okay.
is the natural supplement of the dopamine.
Agreed.
Yeah, dopamine is the one of the that chemical which is it is that chemical which is helping for our all our
Brain
motor
function,
functions.
motor functions.
This is
Perfect.
producing
Perfect, sir.
producing from the
Correct.
brain.
Correct.
In the brain, particular area of the brain, it is producing this dopamine, and that dopamine is affecting for to produce this our motor functions
Correct.
in a proper way.
Correct.
So this L-dopa is the supplement. This in allopathy also it is giving the dopamine itself,
Agreed.
the carbidopa and the these two combinations are giving for
Correct.
to maintain that effect of this that symptoms and all.
Mm-hmm.
So Ayurveda also same way we are also giving this Kabigachu Churnam. It is a natural supplement, so it will be affecting that dopamine. Normally that chemical dopamine which is using, that should have, it is having a drug interaction or food interaction is there. So it
Okay.
should be take before food, then only that
Okay.
effect it will be there. According to Ayurvedic medicine, this Kabigachu is having effect with the food also, because it is a protein rich thing.
Correct.
So automatically that will work in a with the food also. So that
Correct.
is the benefit. So when we are taking this levodopa combination, levodopa and carbidopa combination also, we can this thing,
Okay.
and slowly we can slow down or they cut down the dose of this levodopa
Okay.
carbidopa compound.
So when we are talking more about foods, there is one question related to food. So I thought I'll just take that. So Hare Krishna, I am a paralyzed person and want to know more about the importance of garlic, fermented fruit, that is wine juice, in our devotee life, or how we see it or take it if an Ayurvedic medicine contains the above ingredients. So since it was all related to food, I thought I should
Okay,
take
okay.
this question, sir.
So these two things. One is garlic
Garlic and
usage.
fermented fruit, that is wine.
Garlic it is using in Ayurvedic preparations are there.
Mhm.
Garlic is considered as one of the good medicine to improve our digestive functions as well
Correct.
as to control the acidity and that indigestion, etc. And all it is there. It is not necessary that thing itself we want to take it. There are lot of preparations are there. Lesuniranda Adikashayam and this Ulli Vettidu Adikashayam. Like that, so many preparations are there.
Mhm.
So it is not necessary that medicine to be taken that only it will be work in this condition. There are so many other medicines also it is there. And fermented preparation like Arishta, Asavas and all.
Okay.
I'm a
You
practitioner since last 30 years.
correct.
I am very, very less usage of Arishtas.
Okay.
It is very, if that is that much important, it is there. That Arishta, Asavas and all, it is a fermented preparation
Okay.
that is benefit for especially in the child time. In the
Mhm.
children's and all, it is very easy to take. That type of things and all, it is there. And in some of the cases, we can use. We want to use that also because that only it will be work.
Okay.
That time we can use. Otherwise, it is not necessary to use that fermentation preparations
Correct,
like that.
correct. I think that sir has answered that question very nicely. Thank you, sir, for that. So, does Panchakarma have, because you have a vast experience of Panchakarma, sir? So, there's, let me take one question on this. Does Panchakarma have a role on Parkinson disease? And if yes, which procedures do you recommend to our viewers?
Okay. So before going to the answer of this Panchakarma to the Parkinson's disease, definitely Panchakarmas are affecting in the Parkinson disease.
Correct.
But in a for a common man, I am telling about the Panchakarma because that is very, very important about everywhere. Where is that Ayurveda therapies are happening? Everywhere it is putting that board as Panchakarma therapy like that.
Correct,
So
correct. We've
Panchakarma
seen that.
therapy it is not necessary for everybody in every time.
Correct.
Panchakarma it is the 5 eliminative therapies,
Okay.
5 body detoxifying therapies
Correct.
are using in particular conditions and particular time period. And
Correct.
according to the disease condition, we can use in any time. But
Okay.
otherwise, that 5 treatments to be done in particular that season itself. The particular season also it is mentioned
Oh,
in that. Okay.
that's
For
nice.
example, in this Parkinson disease, Basti is the main treatment. Basti.
Correct,
Basti is the
correct,
enema treatment.
correct.
Basti in various forms of bastis are there. Oil basti is there. Some of the decoction bastis are there. So many type of bastis. According to the condition, according to the disease, medicine it will be various.
Correct.
But basti to be taken in a normal man, if a person is not having any disease,
Mhm.
he also can be take basti for the maintenance of his neurological function,
Correct, correct.
get functions, etc. and all.
Correct.
That person it is called as swasta.
Swasta.
He is called as swasta. That is
Healthy.
he
Healthy.
want to
Correct.
he want to be become healthy and continue.
Correct.
Then he want to take that basti treatment in the Varsha Ritu, in this season.
That's the
Varsha
rainy
Ritu,
season.
rainy
which start.
season.
Correct. Sir.
Yeah, rainy season it is the exact time to do the that basti treatment because
Correct.
after this summer, after while that water is pouring to the that earth, automatically a soreness it will be created. That
Correct.
soreness it will be immediately increase the vada.
Correct.
So
Correct.
that to pacify this vada, this
Oh,
time it is the most
best.
importantly we can use the basti treatment.
Mm.
And another treatment it is called as vamana, that is induced
Correct.
vomiting.
Correct.
Induced vomiting treatment. Induced vomiting it is itself in the textbook it is mentioned vasande vamana. That should be do in the vasanta gala. That means according to our calendar months and all, we can just correlate with the February time.
Okay.
Yeah.
February.
Before summer
Okay.
we want to do that. That is
Right.
after winter, before summer we want to do this.
Correct. Correct. Sir.
So that is the proper time because in the winter summer, the winter time that kabha it will be aggravated. Most
Okay.
of the kabha diseases, asthma conditions, and more joint disorders, that type of things and all it will be there. For that time, it is after doing this vamana, most
Correct.
of the disease can be corrected.
Oh, that's great.
And
Great,
in the
sir.
Virejana, we want to do especially in the Sharad Ritu. Sharad
Sharad
Ritu
Ritu.
means it is in the September, October that time.
September,
After
October.
rainy
Correct.
season,
Correct.
before winter, that time you can see most of the skin diseases,
Mm-hmm.
acidity type of disease conditions.
Correct.
These
Correct.
type of diseases are more prevalent on that disease.
Okay.
To prevent that, we can do the virajana. Virajana is nothing but the medicated purgation, loose motion.
Correct.
Okay,
Correct.
so these are the three main eliminative therapies.
Correct.
And another two eliminative therapies are, one is nasya treatment, nasal drop treatment.
Nasal drop.
Yeah, nasal
You
drop
give it.
treatment, it is mentioned for a swastha also daily. As a
Correct.
daily practice also, you can do the nasya treatment. Nasya
Okay.
treatment means just putting some of the medicated oil to clear your
Nose.
nose and the sinus area and all. It is
Okay.
there. As a procedure, it is good for the brain function,
Correct.
to stimulate the brain and nerve system,
Wow.
and also it correct the catarrhal infections also.
So you mentioned sinus. So will
Yeah,
that help on
sinus
the
condition
sinus
also,
part
this
also?
nasya,
Okay.
it is very effective.
Oh, that's great.
And
Sir.
the fifth procedure, it is called as bloodletting therapy. That is called
Blood
as
letting.
bloodletting.
Blood
That is
letting. Yeah.
bloodletting. Just
Okay.
remove the blood.
Okay.
That is called as rakta moksha.
Okay.
Okay.
Fine.
So all the other condition treatments are fail, not getting any result. That is
Correct.
all conservatory treatment. So
Correct.
oil therapy, some
Correct.
potli, everything under it is done. No result is coming. Then Acharya is telling that it is mainly due to the Rakta Adhiga disease. So
Okay.
Rakta Dushida Vyadhi. So you
Right.
want to remove the blood, then do
Okay.
the treatment, then it will be
Oh,
benefit.
that's great. That's
Okay.
great, sir.
So Panchakarma, I also done the Panchakarma. It is a fashion nowadays. That is why I just explain this thing.
Nahi,
Because
correct.
Panchakarma, it is not like that. Panchakarma, if you are want to do the Panchakarma in a
Correct.
swastha body, if you
Right.
are not having any disease, you should be do in a particular that
Seasons.
seasons.
Correct.
Otherwise, according to the condition, doctor will decide
Correct.
which treatment is good.
Correct.
According to
Correct.
that, you can follow that regimen, and you want to be
Correct.
properly follow the instructions which is given by the doctor. You should not
Correct.
be make the doctor to that make to a dilemma
Correct.
that I can good this thing or
Correct.
not, like that and all. Doctor is having the knowledge that
The best.
which treatment is best.
Correct.
So doctor
Correct.
will be decide and do that. So in
Correct.
this neurological disease, Basti is the best treatment.
Best treatment.
With that, some of the other additional treatment to give the nourishment to the brain, some Sirodhara, Nasya, I already told.
Correct. You
Nasya
mentioned,
is
sir.
various type of Nasyas are there. Some of the eliminative Nasya for the sinus,
Correct.
and some of the stimulative Nasyas are
Wow.
there for the brain and neurological function.
Correct.
So
Correct.
according to that, which medicine is using, that medicine it will be work for that purpose.
Thank you, sir. So you've given an extremely important information, because we see normally people come, we want to do Panchakarma, and then they don't follow the seasonal thing which you mentioned.
Yeah.
I think that answers everybody questions and all the viewers. Please take a note of this. Okay, moving on, sir. Can patients continue modern medicines while undergoing Ayurvedic treatment? I think major of you must be having this question. So
I
what do you
already
think?
answered this thing, because one system we are following,
Correct.
and that system is working somewhat better in our body.
Correct.
Immediately should not think about to switch over to another system.
Understand. Step
You
wise.
should be slowly.
Correct.
That in
Correct.
Ayurveda it is telling that if you are going with the abadhya,
Correct.
you want to go with the pathya,
Correct.
that is good for your condition.
Hmm.
You should be use that pathya food with the abadhya food itself.
Correct.
Should not be stopped immediately, because
Got it.
your body is suit with this abadhya.
Right. Correct.
Okay,
Correct.
then you can slowly withdraw.
Then
According to
it's
the body's
okay.
condition, you can withdraw that. Like that,
Okay.
any system, not a allopathy system or homeopathy or any other medical system which is following, should not be switched to another system immediately.
Correct.
That will
Correct.
be affecting our body. So
Correct.
slowly adopt, and watch with the doctor's intervention. It is very important. Continuously touch with the doctor. Doctor will be see that changes which is happen according to that body's condition. Slowly we can taper down.
Correct.
We can introduce that medicines and all it is there.
Correct. Correct.
Then the body will be work, and the medicine also it will be work.
So it goes hand in hand. Correct. So are there any specific yoga practices, breathing techniques, or medication methods that benefit the Parkinson disease patient?
Definitely, because Parkinson disease is one of the triggering factor is the stress. Stress is the triggering factor.
Correct,
Stress
correct,
will not be create a Parkinson disease, but stress is a triggering factor definitely.
correct, correct.
So automatically that stress relieving techniques are very important. So meditation is one of the very good therapy
Mm-hmm.
to follow a Parkinson disease condition, because then that person will not be get any depressive condition,
Correct,
or as well as this dementia is one of the major
correct.
condition that Parkinson disease are affecting. So dementia and all, it is getting to that person, it will not be happen when once after diagnosis immediately start the meditation and some of the yoga, some pranayamas are very effective, especially some Anilom Vilom pranayam, it
Correct.
is there, and that Brahmari pranayam.
Oh,
Brahmari pranayam, it is very
I
uh,
do that, sir. I know that. Thank you.
Brahmari
I
pranayama
understand.
is a
Correct,
brain
correct,
enlightening pranayama.
correct,
It is
correct.
very good for brain and neurological function
Right,
enhancement.
right, right.
So these things and all, it should be follow from a guru who is having a knowledge of yoga.
Correct,
You just go and study and follow that thing, and if there is any correction is needed, that he can correct it, and that way only that one to be adopted. Otherwise you just see in YouTube and this thing and all
that's
follow,
not
that is not a proper thing.
recommended.
The
Yes.
continuous
Correct.
follow up it is needed with that guru who is having the knowledge of that
Okay.
system. That is very important.
That brings me to one more question. See, about I am about to have an MRI for brain and spinal, right? As I have a bad headache and just at the lower right of my head. So, is it a good idea to go to an Ayurvedic clinic as well? So, basically, he has a bad headache that goes up to the right of his head and going back to his spine and the lower back. So, he's just asking whether should we visit a
Definitely,
Ayurveda
with
clinic or
that
not.
MRI, want to visit a proper Vaidya, proper doctor,
Correct,
and this Ayurveda doctor, and just take that proper opinion about that, whether the doctor can be diagnosed that condition in a proper way.
correct,
Otherwise, he want to go to the neurologist and do a proper diagnosis. Once a proper diagnosis is happened, then go to the Ayurveda Vaidya.
correct.
That also it is possible,
Correct. And
both the
in
way.
continuation with this, there is one question. Are there any medical treatment which can measure the Kampan or Parkinson treatment? The person had missed the earlier part. And is it stress, lifestyle, or genetic? That's what I mean. They just wanted to understand how can you measure the Kampan or Parkinson treatment? Are there any medical tests in Ayurveda?
Medical test means combine this about
Yeah,
that shivering.
correct, correct,
About
correct,
the shivering,
correct,
shivering can we cannot measure the shivering and all.
correct,
Shivering, what the patient is telling that that I am having this much
correct,
reduced means it is
correct.
reduced. It is not reduced means it is not reduced.
Understand.
That it is like a pain. Pain we cannot no, we cannot
Correct,
measure that.
correct,
There is a vast scale only. It is there. You are
correct,
telling you are having the pain of 7. That
correct.
means it is there. That like that shivering and all
Basically,
we cannot
it's
tell
a
that, but
history what the patient tells you.
yeah,
You know,
definitely. Only thing
correct,
that patient should be properly tell that doctor that what is his suffering, proper
correct,
suffering it is there, how much it is
correct,
that it is happened. Then after the treatment, we can measure very well
correct,
properly what is the reduction is happened or not, like
correct.
that.
So, in very quick thing, can you just tell me what are the dietary changes would you recommend for a Parkinson disease patient?
Yeah.
In few things of
Because in the dietary condition, definitely in the Parkinson disease, it is because of the Vada Vaigunya.
correct.
Vada increased the condition. All dry type of food and all we should not be taking. Like that dry salads you are taking and
Mm-hmm.
all, it is there that we want to stop it.
Correct,
Any steamed ones are very good. Freshly
correct,
prepared are very important.
correct,
And
correct.
with cooked with ghee,
Okay,
sesame oil preparations
okay,
are more good. And all type of vegetables are very important. All type of vegetables, especially the proteinized vegetables,
okay.
like Parkinson's, no, automatically if they are taking the synthetic that is like Syndopa type of tablets and all, it is
Correct,
normally doctors are
right.
not allowing to take any the proteinized foods. But then also it is good that that akka mung, that
Ah,
green gram. Green gram is very good for
correct.
to maintain that
Yes.
for the vegetables. In the vegetarians, it is very good. And if it is non-vegetarian, that egg whites and all, it is also advisable.
Okay.
These type of things and all, it is to be daily we want to consume. Then only that body's protein deficiency, it will be reduced. So protein increase, automatically vada is also getting controlled.
Correct.
And daily use of ghee, it is good. Sesame oil, it is good.
Mhm.
And that no dried foods, and no reheated foods, especially which is kept it in the fridge and take it and reheating, and it is not good.
Correct.
And take a fresh food, that is more good, freshly prepared within 3 hours. Just take that food, that is more good for to control the vata as well as other doshas also.
Correct. So it is like eat fresh, be fresh,
Yeah,
and think fresh.
yeah, sure, sure.
It's a good tagline, sir.
Okay.
Okay, so let's move on to another disease factor. We move on to multiple sclerosis part, sir. So multiple sclerosis, it is said that it is considered an autoimmune disorder. So how does Ayurveda interpret this condition for us, sir?
Okay, so it is a little different from this Parkinson disorder, because
Correct.
Parkinson disorder, it is typically a degenerative disorder.
Right.
Here, multiple sclerosis,
Sclerosis.
it is coming as a inflammatory disease condition.
Okay.
So it is coming under what is called as a autoimmune disorder.
Right.
In autoimmune disorder, one of the major thing, it is the this inflammatory, where there is more effective with vata and pitta.
Okay.
Both are affecting.
Correct. Correct.
So here, how it is developing means, what are all the things that causes told for the Parkinson? That are the causes. One of the major thing, that is
Okay.
stress,
Right.
sleep disturbance,
Right.
and these things and all, it is there. And
Absolutely.
another thing, it is that proper food habits. If
Okay.
our food habits are in a not in a proper way, we are taking more sour foods, more acidity foods, more spicy foods, continuously using and all, that may trigger to this condition and all. Autoimmune disorder means it is a triggering factor. These are the
Okay.
triggering factor. These are not, I am not telling. It is the this food and all. It will be make you to get this disease. It is not like that. It is a triggering factors. If you are
Correct.
having an autoimmune, some condition is there. Autoimmunity condition means it is nothing like that. Our normal immunity
Correct.
itself, it is working for in a opposite way of functioning.
Correct.
And it slowly that depleting that coverage of these neurons.
Okay.
Okay, that
Understood, sir.
that melanin sheet, it is totally, it is
Correct.
slowly cut down.
Correct. Correct.
It is damaging. So it
Right.
is also, after damage, we can tell that it is a degenerative disease.
Correct.
But
Correct.
before that, it is happen, it is a inflammation. From that inflammation, this damage is happening. So
So,
autoimmune disorder, we should be treat in this both way, vada as well as pitta,
Vata
to be
and Pitta.
considered.
Okay. So, can Ayurveda help to reduce the relapse or the frequency of relapse of multiple sclerosis?
Definitely, because the relapse is happen whenever that inflammation triggering up, the relapse is happening.
Okay.
So control that inflammation condition. So not to get the inflammation condition, what I am telling that that pitta adhiga that food habits, we want to slow that we want to stop it.
Correct.
And like sour foods,
Mhm.
and this type of what is called as this acid foods,
Correct.
and more this what is called as that sleep disturbance also, it is there. Our digestive function, if it is not there, then also it can be happen. So these so digestive function to be normalized,
Correct.
there will not be any that constipation issues, and sleep disturbance should not be there.
Okay.
So if it is maintained properly, that relapse condition
It
will
will.
not be happen.
Okay. And what are the most common symptoms of multiple sclerosis that people should definitely not ignore?
Yeah, multiple sclerosis condition, there is tingling sensation. It is one of the major
Okay.
thing. Tingling sensation here and there,
Correct.
various parts of the body.
Okay.
It is not in the leg only, hand only. It is not like that.
Correct.
Various part of the body, tingling sensation, it will be there.
Correct.
Some numbness is coming and going like that. It will be there, and some of the muscle soreness. The
Correct.
muscles are all
Correct.
getting soreness. It will be there, and most important symptom, it is that without knowing, you will be get a weakness.
Oh.
a fatigue. If you are
Oh.
taking food, then also you'll be
Mm-hmm.
fatigue. If you are
Okay.
not taking food, also you'll be
Then
fatigue.
also.
So
Oh.
that without
Oh.
knowing
Okay.
that
Okay.
there is
Okay.
fatigueness, it is there, weakness is happening, and
Okay.
tiredness. If
Okay.
you are not working, also you are tired. These
Oh.
things and all it is there. These are some of the symptoms, earlier symptoms. You can see that. If you
Okay.
slowly, if you are not focusing on
Okay.
that, automatically that will develop to the this type of disease
Oh.
condition.
So
So
you must take
if it
care.
is
Correct.
started,
Correct.
you should be watched, and you want to go to a neurologist or the
Okay.
Ayurveda physician, and
Correct.
just a diagnosis, and start some medications, and
Correct.
that some our lifestyle corrections and all.
Correct. Sir, which Ayurvedic treatments are generally recommended for patients with multiple sclerosis?
Ayurvedic treatments
Correct.
in the multiple sclerosis generally, what we are telling in the this thing in the that Parkinson disease, like that Basti is one of the major treatment.
Correct.
Before that, we want to do anti-inflammatory, some of the treatment, some kashaya dhara, some
Mm-hmm.
decoction bath. It is there, and some of internal medicines are there to control that inflammations, and that rejuvenation,
Mm-hmm.
and ojas improvement. It is very
Okay.
important. Ojas, according to Ayurveda, ojas, it is a revitalization part in our body. So
Okay.
that
Ojas.
ojas improvement medications are very important
Okay.
to
Okay. Great.
to pacify this condition, as well as to what is called as the progression arresting also happen with that.
Correct. Correct.
So
Okay.
and this toxicity is one of the major thing. So ama nirharana, ama is considered as in Ayurveda, it is called as toxins in the body. So
Correct.
that is indigested food or any other things.
Correct. Correct,
Okay,
sir.
that transformatory thing which is not digested properly, and it is not
Correct.
taken into the body for its action. So it is
Correct.
called as the toxins. The
All
toxins, it
right.
will be generate, and that toxins, it will be blocked in the
Mm-hmm.
channels, and there will not be proper development. It is to
Okay.
the neurological function.
Okay.
Okay.
So, thank you, participants, for staying with us till now. Now you can see the information moving on your screen. For more information, kindly connect with us. How important are digestion? We say Agni and immunity. You just mentioned about ojas in managing multiple sclerosis.
Yeah, that is the first of all, our digestion is one of the major thing. We want to be
Correct.
look into our daily health activities. If
Correct.
our digestion is not proper, most of the disease can be happen. So in this case of multiple sclerosis, digestion, primary digestion,
Correct.
then the secondary digestion like
Mm-hmm.
metabolism to be corrected.
Mm-hmm.
If it is not correct, automatically that will develop to the this. I told that it is the toxins called as ama.
Ama.
So ama nirharanam, it is one of the treatment.
Correct.
This ama
Correct.
nirharanam, that is the only thing that I told that it is the
Correct.
Panchakarma treatment.
Right.
So any type
Agree.
of Panchakarma treatment we want to do according to the body's condition.
Mm-hmm.
Body, if it is pitta is more, then we want to do the pitta harana chikitsa. Like virajana is the pitta harana.
Okay.
If it is kabha is more, then we want to do vamana chikitsa.
Correct. Correct.
If vada and pitta condition is there, then basti is one of the major treatment.
Okay.
So basti treatment can be done. So according to the condition, the doctor will be decide which treatment is best for that condition.
Correct. So you need to follow your doctor.
Yeah. Then after that, then we want to do the
Correct.
rasayana chikitsa. It is called as the ojas immunity boosting treatment.
Ojas. I'll never forget Ojas.
Yeah.
Thank you for that, sir. So, can stress trigger the multiple sclerosis flare ups? And how does Ayurveda address this condition, sir?
Definitely, stress will be trigger up this multiple sclerosis. Stress is not the condition to get the multiple sclerosis,
Correct.
but it is
Correct.
triggering up because
Right.
for a person who is getting a stress, automatically, according to Ayurveda, there is a heat developing in the body.
Okay.
there is a
Correct.
heat it will be developed.
Correct.
This heat totally it will be slowly it will be increase the inflammatory condition. It will be trigger
Correct.
the inflammation. I
Correct.
already told that trigger
Yes.
that inflammation is the one of the major thing.
Right.
So
Right.
once the inflammation is increased,
Mm-hmm.
so definitely that multiple sclerosis that will be get the
Correct.
flare up.
Correct. And what lifestyle modifications can improve the quality of life for such patients who are suffering with multiple sclerosis, sir?
Do proper activity, that is ahara and viharam according to
Correct.
Ayurveda. Aharam to be properly, I already told that
Correct.
which should be follow that reduce that sour foods, that spicy foods, oil
Correct.
fried items, reheated foods and all. We want to
Right.
we want to stop it and take fresh and very easily digestible things and all we want to take.
Correct.
And some of the fibrous foods and all, it is very good for to improve that digestion as
Correct.
and metabolism as well as our bowel
Right.
movements also.
Right.
And another thing it is that this ama nirharana condition,
Mm-hmm.
we want to add some of the food things itself. That ginger is very good,
Correct.
and amla is good, amla,
Correct.
and pepper, usage of pepper is good.
Right.
That will also all will be increase your digestion and
Correct.
metabolism in a proper way.
Right. So, as sir said, and we have been mentioning, eat fresh, be fresh, think fresh. Correct.
Yes. Okay.
So, we move on to the next disorder, that is peripheral neuropathy, sir. So, peripheral neuropathy often causes numbness, burning, and tingling. So, how does Ayurveda explain these symptoms?
Okay. Peripheral neuropathy means it is affecting to the peripheral nerves,
Correct.
which is connected with the brain,
Correct.
and it controls all our muscle functions,
Mm-hmm.
our all the commands which is passed on to that all other muscles
Correct.
and other activities. It is
Right.
through the peripheral nerves.
Correct. Correct.
So if the nerves are getting weak,
Hmm. Hmm.
it is because of so many conditions are there.
Correct.
Sometimes it is due to some of the what is called a lifestyle disorders like diabetes and obesity disease conditions also can be happen,
Correct.
and some of the drug induced condition also can be happen. So
Correct.
various disease condition, this can be a part of a disease, a peripheral neuropathy.
Correct.
So
Correct.
that tingling sensation and this thing and all, it is happen because the nerves are not having a proper strength
Mm-hmm.
to take the impulses from the brain and to pass to the nerve system.
Okay.
It is
Correct.
because of the nerves are not in a proper function. So there is, according to Ayurveda, it is Vada Vaigunya. Vada is
Okay.
increased in the
Okay.
nerve system.
Correct. There's one question, sir. What are the reasons of stomach heating? And what are the lifestyle to avoid stomach heating? And what should I do if I am suffering from increased heat in the stomach? If you can suggest some for our viewer.
Okay. So stomach heating, it is happen. It is due to improper food habits itself.
Correct. Correct.
And also stress is also one of the cause. I
Correct.
already told that stress, it will be increase the
Correct.
heat.
Correct.
And
Correct.
stress as well as during the stress time, if you are taking food, that also it will be increase the heat.
Agreed, sir.
Okay.
Agreed.
And the spicy foods, all with more chilies, more
Mm-hmm.
more what is called as more masalas and all that
So we
added
need to
and
be
taken in
sattvic.
food, and improper food timings.
Okay.
That food timings that I am having some job, I'll be finish it and then go like that and all. It's continuously, if it
Correct.
is happen, automatically that will affect our digestive
Correct.
disturbance.
So there's one more question, sir. Can a diabetic neuropathy be effectively managed with the Ayurveda?
Diabetic neuropathy, definitely. Diabetic neuropathy can be effectively managed with Ayurvedic therapies and all it is there.
Correct.
Good Ayurveda therapies are there to control this thing. That simultaneously we want to do the diabetic control also.
Okay.
For that diabetes control also we want to do some of the there the Panchakarma treatments are very effective.
Correct.
There is
Correct.
Virejanam, Basti and all, if it is in a proper way, if we are doing with that some of the treatment to improve that neuro system function
So are
enhancement.
those the Ayurvedic therapies are you talking about, sir, about for the nerve regeneration and pain relief?
Yeah.
Yeah. Okay.
That some of the treatments called as Shastiga Shali Pindaswadam, some
Correct.
particular type of rice, it is
Mm.
prepared in a particular decoction, some particular combination of drugs and all, and it is prepared and it is doing that Potli Sweda. it is
Correct.
doing the sweda and all, that will
Okay.
be reduced, that will be improve that nerve function,
Okay.
nerve, and that will be reduce that vada also. So
Correct.
before that we want to do that
Correct.
eliminative therapy like virechana, then
Correct.
basti. With that, this
Correct.
treatment to be done.
And as you mentioned about the different therapies, can you add something about the food aspects also, sir? Like what should we take, what should be avoided?
Yeah, peripheral neuropathy, definitely we want to include good protein foods.
Protein foods.
Good
Okay.
protein foods.
Correct.
You can use soya. You can
Mm-hmm.
use this that green gram.
Correct.
Various
Correct.
daily some of the protein foods you want to take it,
Okay.
and do some of the exercise also, because only
Correct.
protein food you are
You
taking
know, you
and
need to
don't
burn.
doing exercise, that is not a good. You want
Correct.
to take food and do some exercises like walking, some stretching exercise, some what is called as some rubbing things and all it is
Correct.
doing, and
Correct.
some oil applications daily. That will be
Mm-hmm.
improve that peripheral neuropathy
Okay.
conditions and all.
Great, great, great. So let us move on to more of the holistic and preventive approach in Ayurveda. Sir, can neurological disorders be prevented through Ayurvedic lifestyle practices?
Definitely, because Ayurveda is telling that Ahara, Vihara, Aushadha, Kriya.
Correct.
Okay. Ahara, Vihara, you know.
Correct.
Ahara means
Correct.
the food.
Food.
Food
Food.
in a proper pattern, if you are taking,
Mm-hmm.
according to Ayurveda, it is telling that if you are properly following the Ahara,
Correct.
you don't need any medicine.
Correct.
The same
Correct.
way, if you are following that food in the food in a proper way, the
Mm-hmm.
patyahara, if you are following a patyahara,
Mm-hmm.
then also you don't need any food in a
Correct.
medicines.
Correct. Correct.
This both the way. If you are following the patyahara, you
Mm-hmm.
don't need any medicine. If you are
Correct.
not following the patyahara, then also you not need any medicines.
Okay. So
That
you
means
need to follow
you
those
want to
things.
definitely you want to follow the patyahara. Then
Correct.
that itself working as a medicine.
Okay.
Okay, so that itself the body it will be changed for our that innate our body strength, that will be enhanced by doing a continuous using of a patyahara.
Okay.
Then the vihara means our activities,
Correct.
daily activities. It is very important for our physical strength. So
Okay.
do some walking, some stretching exercises, some yoga,
Hmm.
type of some activities we want to
Mm-hmm.
do that. That is called as vihara. Then
Correct.
after, if you are following these two things,
Hmm.
then also you can get some diseases.
Correct.
Okay, then if you are getting disease, then only you want to think of the
Correct.
medicines. That
Right.
is called as aushadha, the third
Right.
one.
There's one question, sir, when we are talking about the stress, the lifestyle, the busy schedules of Mumbai and the whole world. There's one question during stress, fear, anxiety, quarrel. There is a shivering in hands or legs or lips, right? So it is because of weakness of the nervous system or it is the brain issue. So does tests like MRI find out the reason or the cause? Whether they
Definitely,
will be able to
if
find
it
out
is
the reason?
continuously happening, definitely want to go for a DEXA scan and see that whether it is because of any Parkinson related things or
Correct.
not.
Correct.
Otherwise, also that we want to control our stress and see that by doing some of the good
Correct.
meditation,
Correct.
some this pranayama and all, slowly that can be get controlled. But
Mm-hmm.
if these things and all it is following, then also this is coming, then definitely go to a
Okay.
neurologist and take a MRI and see that whether it is due to
Correct.
that or the starting of any Parkinson disease or not,
Okay.
or any otherwise any peripheral neuropathy is there or not.
Correct.
That
Correct.
we want to differentially
Correct.
diagnosed.
Correct. Correct. So I think that's a good answer, sir. Moving on, what are the biggest misconceptions people have about Ayurvedic treatment for neurological disorders?
Misconceptions means any treatment it is doing, it is treatment is not that synonym for the cure.
Okay. Got it.
Treatment is for to improve the innate potential of our body
Mm-hmm.
to become getting a cure. Sometimes it is getting a cure, or sometimes it is a maintenance of your quality of life.
Okay.
Okay,
Perfect.
so some of the disease can be automatically cured.
Mm-hmm.
It is not because of any doctors or any medicines and effect. It is
Correct.
because of the innate potential of our body is enhanced.
The inner voice,
in
basically.
inner potential of our that is I told that ojas. If our
Ojas.
ojas is enhanced, most of the disease can be get
Correct,
reversed.
correct, correct,
If
correct.
ojas is not enhanced, that can be maintained only.
Mm-hmm.
Okay, that can be
Perfect.
maintained. That should not be go beyond that limit.
Mm-hmm.
We can be withhold that disease without any more disturbances and all it is happen.
Correct, correct.
Okay.
Sir, how should patients decide when they need an immediate medical attention instead of relying only on Ayurveda or the home remedies? And how fast they should, move on to any other kind of treatments?
Immediate medical attention means if there is a breakdown, if there is
Correct,
a breakdown, then there is a breakdown maintenance.
correct,
Okay, before breakdown we are doing as a preventive maintenance.
correct,
So if we
correct.
are continuously getting some of the disturbing things in our life, it is there.
Mm-hmm.
We want to go to a doctor and just do the checkup and find out what is the condition and what is the condition and
Correct,
make that our whole lifestyle to be corrected. Once the lifestyle is corrected and go with some 2 or 3 months, then we will be know that after lifestyle correction also this is thing it is a some more disease we want to focus and do some
correct.
treatments and all.
Okay.
It is like that.
Sir, finally, what message would you like to give to our patients, caregivers, viewers who are with us since past 1 hour, who are living with Parkinson disease, multiple sclerosis, peripheral neuropathy? Any
Ma-
advice to them, sir?
Mainly other than the patients, bystanders are very important to especially in the case of this Parkinson disease and the multiple sclerosis,
Correct,
because anytime their mind setup, their stress level and all, it will be fluctuating in the condition. So bystanders are very calmly attend them and give patience to them, make their mind to be very much calm, and what the help they are doing, that things and all we want to properly
correct,
given, then only we can sustain their mental
correct,
status. If the mental status is sustained, their disease progression also it will be sustained.
correct. One quick question from the audience. Can we treat chronic migraine attacks? I think it's a migraine is quite common, sir. So quickly, if you can answer
by
this question, sir.
by this name itself you know that it is a chronic thing.
Correct,
So
correct,
chronic thing means it is not having any this type of any answer. It is not there. You want to consult a proper doctor like Ayurveda doctor. There is definitely there is a treatment is there. Migraine can be cured. There is not a problem. Only thing
correct,
that why it is happened according to that condition we want to assess and what is the stage, what is the severity, what is the intensity, everything we want to assess.
correct,
According to that, do the treatment what the Vaidya is telling, that follow the proper instructions, then
correct,
definitely there will be result.
correct. So thank you, Dr. Anil Kaimal, sir, to join us today in a very informative health talk,
Then
sir. And I thank from the bottom of my heart and grateful to you. You have shared a various and enormous, insights to all of us, including me. So I thank all the participants who have stayed tuned to this health talk with us during the whole 1 hour session. So thank you, sir. And until we take care of ourselves and yourself, please take care of your family. We will meet you soon with our another experienced consultant for another health related topic. Take care. Hare Krishna.
Hare Krishna.
And today's the whole session was eat green, be green and think fresh.
Think
Oh,
fresh.
sorry, eat fresh, be
Be
fresh
fresh.
and think
Think fresh.
fresh. Okay, so now you can see the display on your screen about the new details for the program on the monsoon retreat by Vaidyaratnam Govardhan Ayurveda Hospital. They are giving you an enormous offer. You are getting 20% off on all Ayurveda services and 50% off on all the video consultations. So grab this opportunity and do contact Govardhan, Vaidyaratnam Govardhan Ayurveda Clinic located at GEV Govardhan Eco Village, Wada, Palgal district. Thank you. Hare Krishna.
Hare Krishna.